Alright, here we are with our post-op patient. It's almost post-op day 8th and he's heading home today after a rhinoplasty and a genioplasty surgery. So as you see, we have a lot of plasters intact, the rhinoplast, which I am going to remove, and it is quite painful because of the hair being present there. I'll remove it fast. It will pain, but it will be painful less time. Oh, that's it. Okay, that's it. Relax. So this hurts much lesser. It's okay. An earbud system. Earbud. Better? Okay, so now we will do a pre-op and post-op comparison. So if you see his pre-op picture, he had a very short, stubby nose, and he had something what is called like a V-shape kind, inverted V-shape kind of a nose. So he wanted reduction at the dorsal region. We can give him a mirror so that he can also see. So just hold the mirror down. Yeah. So if you see, your dorsal width has been reduced. We have augmented the dorsum a little bit, given you a nice curve towards the tip. Tip, definitely you have swelling, it will come down. You had a very bulbous tip, and that has been corrected. Alar base, there is still some swelling on both the sides, and we have also reduced the alar base and made your nose a little longer than what it was and given it a nice shape. Earlier it was just one V shape, inverted V kind of a shape. Now if you look at the side, just look there. So now we have maintained this, there's no depression at the radix. This curvature which is there from the radix till the tip has been maintained, and overall given him a long nose. See up? Yeah. So the alar base symmetry also has been maintained, as you can appreciate in the basal view. Overall the changes, what has been done, he has had no rib grafting. So whatever changes have been done is using the septal graft that we harvested, and his nose has become overall longer, narrower and sharper. This tip swelling should subside in the next 2 weeks. Now moving on to the chin. Again we start with the, look at the mirror. Yeah. So he had a very short, a retruded chin. Now it is more forward. Augmentation is done both in the horizontal and the vertical dimension, although the vertical augmentation is less as compared to the horizontal. Also it is in proportion with his facial profile. Look at the nose and the chin. So he has, earlier he had a very retruded appearance of the mandible. Now that has been corrected and he has been given a straight profile. So if you notice this angle, just look at the side and look at the mirror. Look completely at the side. Yeah. So this angle which was there, now that has been corrected, it's more straight now. You tell us, how are you feeling about the result? Are you happy?
Yeah.
Good. And how was your stay here? How was your stay, hospital stay?
Yeah, better.
Good? When are you going now today?
Evening 4 o'clock now.
Evening. After 2 hours. Okay. So since he's heading home in 2 hours, we better, we are going to proceed with the suture removal, clean, take some photographs and send him home. You will have a follow-up number. Okay, we'll give you a follow-up number. In case of any doubts, any problems, you message on that number. You have any doubts?
No, ma'am.